Hey guys, my name is Miraj and welcome back to this channel. And today we will discuss about pneumonia, its causes, symptoms, risk factors, diagnosis, treatment, also prevention and complications. So first of all, let's take an overview about pneumonia. It is an infection in one or both lungs, which is caused by fungi, virus or bacteria. The infection causes inflammation in the air sac in your lungs, which are called as alveoli. The alveoli filled with pus or fluid, making it difficult to breathe. Is pneumonia contagious? The germs that cause pneumonia are contagious. This means they can spread from person to person. Both viral and bacterial pneumonia can spread to others through inhalation of airborne droplets from sneeze or cough. You can also get these types of pneumonia by coming in contact with surfaces or objects that are contaminated with pneumonia causing bacteria or viruses. Now, what are the symptoms of pneumonia? Pneumonia symptoms can be mild to life-threatening. They can include coughing that may produce mucus, fever, sweatings or chills, shortness of breath that happens while doing normal activities or even while resting, chest pain that worse when you breathe or cough, feeling of tiredness or fatigue, loss of appetite, nausea or vomiting, and headache. Other symptoms may vary according to your age and general health. Children under 5 years old may have fast breathing. Infants may appear to have no symptoms, but sometimes they may vomit, lack energy, or have trouble during drinking or eating. Older people may have milder symptoms. Now let's talk about types of pneumonia. Pneumonia can also be classified according to where and how it was acquired. First is hospital-acquired pneumonia. This type of bacterial pneumonia is acquired during a hospital stay. It can be more serious than other types, as the bacteria involved may be more resistant to antibiotics. Second is community-acquired pneumonia. It refers to the pneumonia that acquired outside of a medical or institutional setting. Third one is ventilator-associated pneumonia, when people who are using a ventilator gets pneumonia. Last is aspiration pneumonia. Aspiration pneumonia happens when you inhale bacteria into your lungs from food, drinks or saliva. Now let's talk about risk factors of pneumonia. Anyone can get pneumonia, but certain groups do have higher risk. These groups include infants from birth to 2 years old, people aged 65 years and older, people with weakened immune system, people with certain chronic medical conditions such as asthma, diabetes and heart failure, people who have recently had a respiratory infection such as cold or a flu, people who have been recently or currently hospitalized, particularly if they were or are on a ventilator, people who had a stroke, have problems swallowing or have a condition that causes immobility, people who smoke, people who have been exposed to lung irritants such as pollution, fumes and certain chemicals. Now let's talk about stages of pneumonia. Bronchopneumonia. Bronchopneumonia can affect areas throughout both of your lungs. It often localized close to or around your bronchi. These are the tubes that lead from your windpipe to your lungs. Lobar pneumonia. Lobar pneumonia affects one or more lobes of your lungs. Each lung is composed of lobes, which are defined sections of the lung. Lobar pneumonia can be further divided into 4 stages: congestion, red hepatization, gray hepatization, and resolution. Now let's find out the answer of the question that is pneumonia curable? A variety of infectious agents cause pneumonia. With proper recognition and treatment, many cases of pneumonia can be cleared without complications. For bacterial infections, stopping your antibiotics early can cause the infection to not clear completely. This means your pneumonia could come back. Stopping antibiotics early can also contribute to antibiotic resistance. Antibiotic resistant infections are more difficult to treat. Viral pneumonia often resolves in 1 to 3 weeks with home treatment. In some cases, you may need antivirals. Antifungal medications treat fungal pneumonia and may require a longer period of treatment. Now let's talk about diagnosis of pneumonia. The doctor will take your medical history. They will ask you questions about when your symptoms first appear and your health in general. Also, depending on the severity of your symptoms and your risk for complications, your doctor may also order one or more of these tests. Chest X-ray. An X-ray helps your doctor to look for signs of inflammation in your chest. Blood culture. This test uses a blood sample to confirm an infection. Next, sputum culture. During a sputum culture, a sample of mucus is collected after you have coughed deeply. It's then sent to a lab to be analyzed to identify the cause of infection. Then, pulse oximetry. A pulse oximetry measures the amount of oxygen in your blood. CT scan provides a cleared and more detailed picture of your lungs. Fluid sample. If your doctor suspects there is a fluid in the pleural spaces of your chest, they may take a fluid sample using a needle placed between your ribs. This test can help to identify the cause of your infection. Bronchoscopy. A bronchoscopy looks into the airways in your lungs. It does this using a camera on the end of a flexible tube that's gently guided down your throat and into your lungs. Your doctor may do this test if your initial symptoms are severe or if you are hospitalized and do not respond well to antibiotics. What is the treatment of pneumonia? Your treatment will depend on the type of pneumonia you have, how severe it is, and your general health. Your doctor may prescribe a medication to help treat your pneumonia. What you are prescribed will depend on the specific cause of your pneumonia. Oral antibiotics can treat most cases of bacterial pneumonia. Always take your entire course of antibiotics, even if you begin to feel better. Not doing so can prevent the infection from clearing, and it may be harder to treat in the future. Antibiotic medications don't work on viruses. In some cases, your doctor may prescribe an antiviral. However, many cases of viral pneumonia clears on their own at home. Antifungal medications are used to fight fungal pneumonia. You may have to take these medications for several weeks to clear the infection. Your doctor may also recommend over-the-counter medication to relieve your pain and fever as needed. Your doctor may also recommend cough medicine to calm your cough so you can rest. Keep in mind, coughing removes fluid from your lungs, so you don't want to eliminate it entirely. You can help your recovery and prevent a recurrence by getting a lot of rest and drinking plenty of fluids. If your symptoms are very severe or you have other health problems, you may need to be hospitalized. At the hospital, doctors can keep track of your heart rate, temperature, and breathing. Hospital treatments may include intravenous antibiotics injected into a vein, respiratory therapy, which involves delivering specific medications directly into your lungs, or teaching you to perform breathing exercises to maximize your oxygenation. Oxygen therapy to maintain oxygen level in your bloodstream. Now let's talk about how we can prevent pneumonia. In many cases, pneumonia can be prevented. The first line of defense against pneumonia is to get vaccinated. There are several vaccines that can help to prevent pneumonia. Prevnar 13 and Pneumovax 23. These two pneumonia vaccines help to protect against pneumonia and meningitis caused by pneumococcal bacteria. Your doctor can tell you which one might be better for you. Prevnar 13 is effective against 13 types of pneumococcal bacteria. This vaccine is for children under the age of 2, adults aged 65 years and old, people between aged 2 and 64 years with chronic conditions that increase their risk for pneumonia. Pneumovax 23 is effective against 23 types of pneumococcal bacteria. This vaccine is for adults aged 65 years and older, adults aged 19 to 64 years who smoke, people between age 2 and 64 years with chronic conditions that increase their risk for pneumonia. Flu vaccine. Pneumonia can often be a complication of the flu, so be sure to get an annual flu shot. Everyone aged 6 months and older get vaccinated, particularly those who may be at risk for flu complications. HIV vaccine. This vaccine protects against Haemophilus influenza type B, a type of bacteria that can cause pneumonia and meningitis. This vaccine is for all children under 5 years old, unvaccinated older children or adults who have certain health problems, individuals who have gotten a bone marrow transplant. Pneumonia vaccines won't prevent all cases of the condition, but if you are vaccinated, you are likely to have a milder and shorter illness, as well as a lower risk for complications. Other preventive tips are: try to avoid smoke, regularly wash your hands with soap and water, cover your mouth when coughing and sneezing, maintain a healthy lifestyle to strengthen your immune system, get enough rest, eat a healthy diet, and get regular exercise. Together with vaccination and additional prevention steps, you can help to reduce your risk for getting pneumonia. What are the complications due to pneumonia?
Pneumonia may cause complications, especially in people with weaker immune system or chronic conditions such as diabetes. If you have certain pre-existing health conditions, pneumonia could make them worse. These conditions include congestive heart failure and emphysema. For certain people, pneumonia increases their risk for having a heart attack. Bacteremia. Bacteria from the pneumonia infection may spread to your bloodstream. This can lead to dangerously low blood pressure, septic shock, and in some cases, organ failure. Lung abscesses. These are the cavities in the lungs that contain pus. Antibiotics can treat them. Sometimes they may require drainage or surgery to remove the pus. Impaired breathing. You may have trouble getting enough oxygen when you breathe. You may need to use a ventilator. Acute respiratory distress syndrome. This is a severe form of respiratory failure. It's a medical emergency. Pleural effusion. If your pneumonia isn't treated, you may develop fluid around your lungs in your pleura, called as pleural effusion. The pleura are thin membranes that line the outside of your lungs and the inside of your rib cage. The fluid may become infected and need to be drained. Last complication is death. In some cases, pneumonia can be fatal.
If you like this video and want more videos like this, then subscribe this channel. Also share this video with your friends and family. And thank you for watching this.